Recorded on location at Aspen Ideas Health in Aspen, Colorado.
We're on location at Aspen Ideas Health, and we're talking today with Admiral Rachel Levine, Assistant Secretary of Health for the U.S. Department of Health and Human Services.
We'll see what happens next year and the potential for next term. And I absolutely would be willing to do that, because I firmly believe in the Biden-Harris administration and the principles that they advocate for and they represent.
Admiral Levine made history when the Senate confirmed her for this important role during the height of the COVID pandemic. And now we're going to learn the Assistant Secretary's newest concerns as she continues her important focus on the health of the nation.
We have released a heat health index looking at the zip code level about all the different factors that would influence extreme heat, but then other factors as well that would influence the health of people, other aspects of the social determinants of health.
And this is Conversations on Healthcare.
Well, Admiral, welcome back to Conversations on Healthcare.
Well, thank you. I'm very pleased to be here in such an amazingly beautiful setting.
And so intellectually stimulating, but before we get to some of the conversations that are going on around here, it's still June, it's Pride Month, happy Pride, and we thought maybe we'd talk to you a little bit about the work that you and your colleagues have been doing around the country on this very important matter.
Well, thank you very much, and happy Pride. Yeah. And so health equity and equality are fundamental to everything that the Biden-Harris administration represents. And so we are working in Health and Human Services under Secretary Becerra's leadership about health equity, and particularly during Pride Month and around the year, for health equity for the LGBTQIA+ community. And so all of our principals, as well as the Secretary, have been out and about doing events and roundtables and discussions about health equity for our community. And I have been all over the DC area and then other places all over the country talking about this as well. It is so important to emphasize health equity for our community and all of the different challenges and health disparities that we have.
But there's so much energy around the country. I know we see it in terms of our own home communities that we serve. Very important to celebrate this time.
Well, thank you so much. I really feel that energy as well. And that's why I always say that Pride gives me hope. Pride gives me hope for the future. And you see that in our community and with all of our allies during Pride Month. And we have to continue up those efforts, though, all year long. To benefit our community and to deal with the health disparities that the community suffers from.
And I'll tell you, we've seen it as a competitive hiring advantage. I think when we interview young people especially, whatever their background, they want to work for a place that believes that this is a positive force. So.
Well, I am such a firm believer and advocate for diversity, equity, inclusion and accessibility. Now, the EIA has taken its hits lately and has been criticized, but I think that's for political and ideological purposes.
It's not what we see with the young people.
That's great.
Absolutely.
Well, young people are always our hope. And so it is so important that we have a diverse set of opinions and perspectives for really any organization in government or in the private sector.
We've added the word justice, equity, diversity, inclusion. So we say it's Jedi.
Jedi.
So we're very...
I love that. And of course, from the original Star Wars era.
Of course.
I understand.
Well, Admiral, you are so admired and so respected for so many reasons, including to being the first transgender person to be approved by the U.S. Senate to an administrative position, confirmed by the U.S. Senate, I should say. So we wanted to ask you, would you ever be willing to go through another confirmation process? And do you think you might have that coming up in your future?
Well, we'll see what happens next year and the potential for next term. And I absolutely would be willing to do that, because I firmly believe in the Biden-Harris administration and the principles that they advocate for and they represent.
I want to talk a little bit about bird flu. And former CDC Director Robert Redfield said he thinks bird flu will enter humans, and his sort of prognostication is significant mortality. What's your sense of what's happening out there?
We don't know that right now, and so it depends upon what time period you're looking at over the next 100 years or more.
Right.
So, pandemics do happen, and of course we have just come out of the acute phase of the biggest pandemic that we have seen since the 1918 influenza pandemic. So we don't know the future, but we certainly know that there are many challenges that we have to prepare for, and so that is what the Biden-Harris administration is doing with their new office of Public Health Preparedness, led by retired General Friedrich, and then our secretary, and then our work with the CDC and ASPR, and really across HHS, is that we recognize the challenges with H5N1, and we're working with our colleagues at the USDA in terms of the cattle herds that have been impacted, and the 3 individuals that have had mild forms of H5N1 in the United States. And we are working together every day across HHS, with the USDA, with the White House, and more, to make sure that we are prepared whatever the eventuality is.
But a better early warning system than we've had before.
We do. We have a better warning system, and we have to even make it even better, right? So there's always continued improvements that we can make, but we are working on that every day.
Well, we know that you never can take your eye off what's going on around the world in terms of potential threats to the global public health. Early in my career as a public health nurse, I remember mastering what I had to about syphilis so I could treat it, and thinking I'm never going to see this again, probably in my career. But that didn't happen, and now we really think we're seeing a reemergence of syphilis in all populations, including, of course, babies. And we hear that you have some important news, perhaps, about point-of-care testing.
That's exactly right.
Tell us about that.
So what's old is new,
Yep.
and I remember diagnosing and treating syphilis in my residency program and my fellowship in the 80s, and we had very few cases of syphilis globally, and in the United States around the end of the 90s and in 2000. But now syphilis is back globally and in the United States, primary and secondary syphilis, and then of course congenital syphilis. And so we have started a syphilis task force across HHS, including also the DoD, the Defense Health Agency, and the VA. And we're looking at all of the different data and prevalence of syphilis. We're looking at screening and testing for syphilis. We're looking at different treatments, the syndemic aspect and the equity aspects, as we were saying, and of course how to communicate that to the public. So one important relatively new opportunity are rapid point-of-care tests for syphilis. And they have tremendous opportunities with some challenges. No test is perfect, but it is, I think, the right test at the right time. And in the last couple weeks, we released a point-of-care considerations document from the Syphilis Task Force.
Wonderful.
So that these rapid point-of-care tests, they can make a diagnosis within 15 minutes, can be done in emergency departments, in sexually transmitted disease clinics, in urgent care centers, and more. And I think they have a new opportunity. The other new thing that was just released from the CDC as well is a doxy-PEP protocol, doxycycline post-exposure prophylaxis protocol. And that is again, the right thing at the right time, where one dose of 200 milligrams of doxycycline can be prescribed by a medical care provider to someone who has been exposed potentially to sexually transmitted infections, including syphilis, and is shown to be very effective in preventing the clinical manifestations, preventing that disease. So, you know, with those opportunities, I think we're going to make progress.
Great.
There's one more thing I'd like to mention, if you don't mind, is that we have been having a shortage of the treatment of choice for syphilis, which is penicillin, particularly Bicillin LA, or long-acting. Now that is produced in the United States by Pfizer, and we have had significant discussions with Pfizer on a regular basis, and I really want to highlight they're working with us really carefully. They're understanding the significant public health challenge, and they are working very hard to increase and ramp up their production to meet the needs of the moment. I'm going to have the opportunity to visit their plant later in this later by the end of
Come
the
up
summer.
to Connecticut.
And we're going to be working with them. Well, actually, their plant is in Michigan.
Too bad.
It's in Rochester, Michigan. And I just really want to commend them for the work that they're doing, and they're working right with us to increase production so we can appropriately respond to the challenge of the moment.
I want to get back to syphilis and really, well, the science is there. What about the communication, the elimination of stigma? How are we addressing that? Because we got the science part under control. What are you seeing around the country, the best effective measure of communicating with people?
Well, we need to communicate with the public. We have learned how important that is. Public health communications during the acute phase of the COVID-19 pandemic. And so we are working that. We have a specific subcommittee with our office and CDC and Indian Health Service and HRSA and more, working to communicate all of these issues that we've been discussing to the public that needs it most. There is a strong health equity issue and a syndemic aspect to this, with the cluster of different issues of HIV, hepatitis, sexually transmitted infections such as syphilis, including syphilis, and substance use, particularly fentanyl-related compounds and methamphetamine. And so we need to get our message to the communities that need them most, including the Black African American community, the American Indian Alaska Native community, and our LGBTQIA+ community with gay and bisexual men and other men who have sex with men.
Well, hopefully all the work that you've done around making PrEP something available in communities, in health centers, offices, on mobile health units, which seems to be one of the new ways to get it out there. Hopefully this will help us get there faster.
You know, if someone is at risk of HIV and is getting PrEP, which is such a fantastic advance, then they should be tested for hepatitis and they should be tested for syphilis. Unfortunately, we don't have a vaccine for syphilis, and I know that type of research continues at the NIH and more. But in the meantime, we have a lot of tools, and we're going to put those tools to use.
Great. Well, here we are in Aspen. In addition to the cottonwoods, we've also been treated to cool nights, breezy days, sunshine, and yet at the same time, we know across the country, and particularly on the East Coast right now, but we've also seen it out west, people are really suffering under extreme heat. And I know the Biden-Harris administration has just released a plan for dealing with extreme heat, particularly in communities that are most affected by it and where we see the biggest inequities from climate change and increased heat. Tell us about that.
So that's exactly right. So through our work with our Office of Climate Change and Health Equity, as well as with the CDC and more, we have released a heat health index, looking at the zip code level about all the different factors that would influence extreme heat, but then other factors as well that would influence the health of people, other aspects of the social determinants of health. And so this is at the zip code level in the continental United States, and it's really an important tool for us in the federal government, but also for state and local governments to look at different jurisdictions that are going to be most at risk of heat and heat impacting health and influencing people most at risk, including children and babies, but also seniors, and also workers that have to work in that heat. So you're exactly right. We are seeing heat-related injury throughout and health problems throughout the United States and globally, and that certainly impacts and shows the impact of climate change on health.
Are you seeing anything already from last week?
We are.
At the federal level?
We are. Well, we are seeing significant health impacts with people getting very ill and even some deaths due to the heat along the East Coast and in the Midwest. And that has been seen actually throughout the world.
You know, in our day jobs, we run a large federally qualified health center, and we know with young people coming in, we have this conversation about the environment. And unless we strike that note about the environment, we're going to lose a whole generation of young people into the public health arena because we are tone deaf about the environment. And so kudos to the Biden-Harris administration around the environment. But let's talk a little larger about climate and the catastrophes that are happening out there. And there's been conversations here today. How would you frame up about where we are in terms of not survivability, but you know, how the planet is doing?
Absolutely. Well, first, I want to give a shout out to federally qualified health centers, our community health centers. You all do absolutely fantastic work and really work towards the common good and help people. So thank you. So, you know, 2023 was the hottest year on record. We're on track to beat that in 24, and 2023 might be the coolest year that we ever see in our lifetime.
Oh my God.
Because the impacts of climate change and extreme heat. But there are many other climate-related challenges that we're seeing, including extreme storms, hurricanes and more, but also other storms across the continental United States that are exacerbated, that are stoked by climate change. We're also seeing the impacts of sea level rise on our coasts. We're seeing the impact of forest fires and the resulting smoke, which are common here in the West, but we saw even in Washington, D.C. and was seen in New York City last summer. We're also seeing the increase in vector-borne diseases, particularly dengue, which is a mosquito-borne disease in many parts of the South America and into the Caribbean more, coming up because of the range of the mosquitoes is increasing because of climate change. In Pennsylvania, where I'm from, we have seen an increase in Lyme disease to every county in Pennsylvania, where previously, a number of years ago, it was only in the warmer southeast. So we are seeing these impacts of climate change on health, and health is finally at the table. In terms of the climate discussion. The Secretary has a seat on the National Climate Task Force. I had the opportunity to go to COP28 in Dubai, where we had the first ever climate and health day to talk about these issues globally. And so, the Biden-Harris administration is committed to addressing the root causes of climate change and the health impacts.
What's your message to the K to 12-year-olds about how they can participate in helping improve the climate?
My message to young people, and again, I'm a pediatrician, adolescent medicine specialist, is I'm a positive and optimistic person, and my message is a message of hope for the future. The young people are our future, and we want them to understand the realistic challenges that we face, but to work towards the changes that we need to make, but to have hope for our future. Climate impacts are health impacts, and so they really go together, and all together we're going to make the changes that are necessary.
Well, I appreciate that vote of confidence and forward motion. We're here at Aspen. There have been a lot of discussions on different panels. Anything that jumped out at you that people are speaking to in terms of addressing catastrophic climate change?
Well, we just had a panel, for example, with Dr. Vanessa Carey, and another woman that actually is from the South Pacific. And it was a very interesting panel about the global aspects of climate change, and then from my perspective, the domestic aspects of climate change, and all the work that we need to do. And the world is watching. Our young people are watching.
Exactly, as Mark said.
They're not just seeing what we say. They are watching as young people is what we do. What are we doing to impact that? And we're going to do everything we can to do that. Our work with our Office of Climate Change and Health Equity is working with the health sector on resilience to the impacts of climate change, and then also actually to work towards decarbonization with money from the Inflation Reduction Act.
Perfect.
So that was a very impactful session. I've heard there have been other sessions about food and nutrition security, which is absolutely critical, as well as food as medicine. So many vibrant topics at Aspen Health Ideas.
One of the challenges I think America faces, and maybe globally, is that people are not trusting science. And adding fuel to that fire is that there's been a number of research misconducts that have been identified. And we've had a conversation with Dr. Kirsten Bibbins Domingo about the work she's doing. But I know this is important to you about establishing trust in science.
That's exactly right.
And we're trying to build that back. Talk through what the problems are and how we're going to go about in trying to solve this.
Sure. Well, there are two aspects of that which I think are very important. The first is the mistrust in science itself, and the misinformation and overt disinformation, particularly on social media, about science, and for example about the health and safety of vaccines. Vaccines are one of the victories of public health in the 20th and 21st century, and so it is so important that we keep up up our childhood immunizations, our adolescent and adult immunizations, that we keep up immunizations for influenza and for COVID-19 as well across the United States and globally. So we're continuing to work and try to refine our public health communications. In terms of research, actually, within my office of the Assistant Secretary for Health, we have an Office of Research Integrity, looking at just the things you talked about, research misconduct, and working to investigate that and take appropriate actions, working with the NIH and working with academic medicine and with other research institutions. So it's a absolutely critical, important office that is absolutely a priority, because we have to make sure that the research that we put out there is accurate and it has no miscommunication in itself.
And I want to get back to communications, social media. On one hand, social media is a sinkhole of maybe disinformation, but on the other hand, it's what young people are listening to. How are you rethinking, reimagining the delivery of very vital information on things like TikTok and other means that young people are listening to?
Well, the federal government doesn't use TikTok, but we do use other mediums such as X, formerly known as Twitter, as well as Instagram and other platforms.
I'm thinking about my kids.
Okay, so we are on those platforms, and we are using those platforms, and we want to make sure that we work with trusted messengers for young people and adults to get the word out about public health and such important topics such as vaccinations. But there's another side to social media for young people, and that's one of the things that our fantastic Surgeon General, Vice Admiral Vivek Murthy, is talking about. Yeah. And he put out an amazing op-ed a week or so ago in the New York Times, and he had a previous Surgeon General's advisory about some of the potential dangers of social media for young people, particularly young adolescents, and how they can be misled on social media, how it can come to dominate their life, how they can be bullied on social media and social media harassment. And he put out wants to put out a Surgeon General's warning about this. Now that will take an act of Congress to be able to do that, but I think that his op-ed has set a marker for conversation and discussion, and it certainly has gotten that. There has been a lot of conversation about that, and then different ways that we can protect young people and protect our society from some of the negative sides of social media, and so I think it's a very important conversation to have, and I applaud Dr. Murthy, our Surgeon General, for in starting and continuing and enhancing that conveation.
Yeah. We've been following his work. I think he spoke here last year, if I'm not mistaken,
He'll be here tomorrow.
And it was so impactful. Your reach is pretty vast in your position.
Well, thank you.
So much to think about. But we talked a little bit about mental health with the children and social media, but mental health generally has really taken a very prominent place in the administration's focus.
It has.
I think you were on a panel here speaking to mental health issues, workforce, community supports, digital tools. Tell me what you're feeling hopeful about and what you see as maybe pragmatically likely to get some more attention in the coming year?
Well, we have certainly seen significant mental health challenges across the United States and globally that has been exacerbated by the acute phase of the COVID-19 pandemic. And so we are seeing significant mental health challenges. Again, you know, I'm a pediatrician, adolescent medicine specialist in young people, but adults as well, and seniors, and across the lifespan. So there has been a tremendous amount of work called for by the President and the Vice President, and then work on through the leadership of our Secretary with all of the divisions at HHS on this. So of course SAMHSA, the Substance Abuse Mental Health Service Administration, has a lot of work in terms of mental health for youth and adults. HRSA as well, the Health Resources Service Administration, CMS coverage for that work, as well as working on parity, insurance coverage parity for mental health. And so lots of work being done on access, on the workforce, on telemental health, and more. And so, I think we're starting to make a difference. I think we're starting to see a change, but there's much more work to go. The other aspect of that with mental health that I want to emphasize is the disease of addiction and the overdose crisis that we're seeing, particularly with fentanyl-related compounds, but then other novel compounds such as xylazine, which is a veterinary anesthetic. And so, with our Secretary's overdose prevention strategy, working on prevention in all of its aspects, harm reduction, including naloxone and other overdose prevention agents, fentanyl test strips, xylazine test strips, evidence-based syringe service programs, and more. Treatment for addiction, particularly medication for opioid use disorder with buprenorphine and other compounds, and then getting people into recovery using peer specialists and more. And we are just starting to see an impact, just starting to see a leveling out, but it still is a crisis that we're emphasizing.
We follow that by community and zip code level.
That's
and
right.
It is, when you think of a small city and 160 people in a year lost to opioid overdose, it's just tragic.
It is tragic, and it's something I've been working on throughout my career in public service, starting in Pennsylvania with a standing order prescription for naloxone for the state, and then including my work here in collaboration with Assistant Secretary Delphin Rittman, and then many others in the administration that are concentrating on. Dr. Mandy Cohen is also concentrating on that with the CDC as well. So we are committed to making an impact.
And it's so important. We say that social isolation is the modern day leprosy, and trying to figure out how we help build communities, because again, we have some of the science where we can help prevent that, but again, I think young people are feeling the sense of isolation. We could point at social media, but there are many factors that go into it.
So it's important to emphasize, of course, the Surgeon General has also been talking about loneliness and social isolation as well. And at this point, I think it's critically important to mention the 988 hotline, the 988 suicide and mental health hotline, and how important that is to have someone that can, a trained professional that can talk with someone. It's available throughout the country. It even has a prompt 3, through text chat or texting or phone calls for young people in the LGBTQI plus community, for someone that's trained with our community to be able to respond. So 988 is so critically important.
Well, I know that we have talked about COVID, long COVID, and everything COVID for years in events, but I'm going to swing back to long COVID again for a minute and ask if there's anything on the agenda that you're working on long COVID, because like so many things, this is affecting a group of people profoundly, and yet we don't see too much coming out in terms of treatment and resolution. We're learning some new things from research, but update us.
Well, long COVID is critically important and is absolute focus of our work. So long COVID is real. That is the first thing that we want to emphasize from the beginning, because there has been misinformation about that. So long COVID is real, but long COVID might not be one thing. It's complex. And so, as are other infection-related chronic illnesses. And so we are really taking an approach looking at short, medium, and long-term successes and outcomes in order to address this. So we have our Office of Long COVID Research and Practice that is nested in my office of the Assistant Secretary for Health. And we are playing a coordinating role, for example, with the NIH and their RECOVER project. The RECOVER project is going apace. It is going as fast as humanly possible. That includes the clinical trials that are progressing. They're going to be opening the final two clinical trials this summer. And it's hard to put a timetable on when clinical trials will end and when science will have a result, but we're very hopeful for those clinical trials. We have heard that there are others working on clinical trials in Wells, and we certainly support that. In addition, we're getting very important other data from RECOVER, as well as CDC research, as well as great research from the VA. In addition, ARC has 9 long COVID centers throughout the country that are working on clinical care paradigms and hub and spokes models for that. We're working with HRSA on making sure that primary care doctors are educated. I know that Project ECHO, which is through the University of New Mexico, and Dr. Arroyo has a long COVID modules for education of primary care physicians. We're working with our ACL office in terms of disability, and we work with Social Security Administration in terms of disability. So, and then with the Labor Office in terms of workers. So this work is happening across the administration. It is a priority of the administration. We have actually every month or so a long COVID coordinating committee meeting involving almost every agency administration, and we're going to do everything we can to support people impacted by long COVID and their families in our communities.
Well, that's fantastic.
One last question, but I'm going to note that Margaret Flinner joined the Community Health Center 45 years ago as part of the Commission Court Scholar Program. And maybe you could tell us a little bit about the Corps, because it's such an important, vital resource to all Americans.
Thank you so much for emphasizing that. So, you know, one of the biggest honors that I have as the Assistant Secretary for Health is the opportunity to take my commission and assume the uniform and to lead with the Surgeon General the United States Public Health Service Commission Corps. And that includes over 5,600 dedicated medical and public health professionals that serve the disadvantaged communities in our nation and throughout the world. That includes 1,500 or more officers that serve in the Indian Health Service. We provide medical care for the Coast Guard. We provide medical care at the Federal Bureau of Prisons. We provide medical care for ICE detention centers and in other very challenging and remote areas of our country. In addition, we have great public health professionals that work at the CDC and the NIH and the FDA and at HRSA and SAMHSA and throughout HHS, but also work for the National Park Service and more. So, you know, they are absolutely fantastic officers. The Surgeon General and I are working with our staff to do everything we can to support them, to support recruitment, to support retention, to support wellness. And it is just, we have the only uniform public health service in the world. The only uniform public health service in the world, and it's a national treasure that we are proud to support.
Wonderful.
Well, Admiral Levine, we thank you for your dedication, for your service, and your relentless optimism that there is a solution to each of these major problems that we talk about. And we want to thank our audience, as always, for joining us. Don't forget, you can find us on X, on Facebook, on YouTube. Look at CHC Radio, and we always welcome your comments and your questions. Admiral Levine, thank you, and continued courage and strength to fight the good battle.
Thank you. We're going to fight the good fight and work towards the common good.
Absolutely.
Thank you so much.
Thank you. This copyrighted program is produced by Conversations on Healthcare and cannot be reproduced or retransmitted in whole or in part without the express written consent from Community Health Center, Inc. The views expressed by guests are their own, and they do not necessarily reflect the opinion of Conversations on Healthcare or its affiliated entities.